We are Bridges. We are a specialist, sustainable and impact investor. So what does that mean? That means that we seek to invest in businesses, in projects, in third sector organizations to deliberately achieve positive social outcomes. We focus on several things. And our investment approach is really to think about the sort of big issues you've all been talking about today, and then think about how the third sector and private investment can contribute to those solutions. We at Bridges don't believe that this just is an issue for the government, that the private sector and the third sector have got a major role to play here. So when we think, so what's our investment approach? What do we do? So in the case of health and well-being, we think about all the issues that have already been very eloquently talked about. So rising obesity, and particularly childhood obesity, issues and challenges around the aging population, pressure on the NHS. And we do that across a number of different fund platforms. So we invest in growth businesses, so normal private equity into businesses that can solve these challenges, like the Gym Group. In real estate solutions, we invest permanent and patient capital into social sector organizations, into employee-owned businesses. And we've also pioneered social impact bonds. And at the end of my talk here, I'm going to be talking mostly about social impact bonds, outcomes contracts, payment by results contracts, call them what you will, and how they can be a solution to bring together all the people concerned. So just to give you a flavor for some of our investments in growth business and the approach. So the Gym Group, I met John Trahan just over 10 years ago, and the two of us sat down literally with a blank sheet of paper to think about how we could encourage activity. And we looked at the gym market over the past X number of years, and surprise, surprise, gym membership had been pretty flat. Why? Because it really, most people, frankly, couldn't afford it, and in the most underserved parts of the country, there was simply no availability. Typically being charged £50 or more for gym membership and being required to sign a one-year contract. So you're looking for someone to make a £600, £1,000 commitment up front, and how many people can afford to do that? So we sat down with a blank sheet of paper and thought about how can we make gym membership easy in, easy out, and we targeted £15 a month as an annual membership, trying to make it accessible for all. Another good example, going on from previous talker, is Innovate Catering, or our impact food group. As Tani said very eloquently earlier, childhood obesity is a disgrace. Across the country, over a third of children will leave primary school obese or overweight. And here in Westminster, seat of government, 43% of the children in this borough will leave primary school obese or overweight. It's a disgrace. So we're trying to combat it. Where can private capital play? Through the Impact Food Group, we are working with now over 200 schools, providing much healthier school catering. Health by stealth, so just putting a green salad in front of them and saying, well, have that instead of your chips, ain't going to work, but it's a process. And the Impact Food Group also works very, very closely with the schools, integrating education about diet and nutrition and what they're eating in and out of school into the curriculum. Going back to the Gym Group, people say to me, oh, well, this is all lovely, Phil, all this impact stuff, but of course we couldn't invest in it. I mean, you're just not going to make the right kind of financial returns. The Gym Group is a great case study for me to push back at people. From that first £1 million investment with John Trahan back in 2007-2008, the Gym Group's now fully listed on the UK Stock Exchange, market cap of about £500 million in 10 years. It's got now about 150 gyms spread right across the UK and in many of the most underserved areas of the UK. It has a present active membership of just about 750,000 people, and has reinvented the low-cost gym business in the UK. Of those members, well over a third of them have never been members of a gym before. So actually, by thinking about these big societal issues, and if you can find disruptive, innovative ways of addressing these issues, not only can you can clearly make a fantastic financial return. In real estate, through our Care Places fund, we've built in the last few years 15 end-of-life dementia care homes right across the UK. And through Birch Grove, one of our latest investments, we're addressing the problems around aging. So the number of people over 65 is expected to increase by about 50% over the next 20 years. How are we going to care and house these people? So Birch Grove is a new assisted living business, affordable, for-rent model for the very elderly. And then in terms of social business, we believe the third sector has got a big role here. The problem with many third sector organisations is they find it difficult to raise patient capital to fund their growth and investment. So a few examples here. I'll maybe just touch on one in the interest of time. So the Ethical Housing Company, it's one of our more recent ones. What they're trying to solve is the social housing problem in the Northeast and the pressure that's being put on social housing. So this is a private sector response. Through the Ethical Housing Company, we're buying property right across the Northeast, particularly around Redcar, disused homes, homes in disrepair, buying them freehold, and then renting them ethically as private rented sector housing on social rents to people that can't get on the social housing ladder in the Northeast. An area I'm particularly proud about is the work that we've done around social impact bonds, really innovative. The UK has been a real leader in pioneering impact bonds or outcome contracts. David Cameron made it a key item when he was chairing the G8 a few years ago. There's been about 113 SIBs or outcomes contracts commissioned across the world. Almost half of them have been in the UK, and we at Bridges have financed 27 of those 43. So what is an social impact bond or an outcome contract? Well, many of you here, I'm sure, have been involved in public sector outsourcing or contracting one way or another, and you kind of know how it goes, right? So the commissioner does a detailed spec of the service that he wants provided. It goes out to tender to a whole bunch of organisations who tender. Unfortunately, most third sector organisations don't have the balance sheet or the finance to even bid for those contracts. They tend to be tendered on a lowest cost basis for the service that's been specified. The contractor then seeks to deliver the service as has been prescribed in the lowest cost way whilst making a profit along the way. Where was the beneficiary in any of that conversation? What outcomes contracts do is turn the whole thing on its head and say, well, what outcomes, Mr. Commissioner, are you looking to achieve? So, and what price would you put on, for example, getting somebody who's persistently rough sleeping into stable accommodation for a year off drugs or alcohol or whatever is the underlying issue, and into some form of training and education and into the work. Mr. Commissioner, if that's the outcome you're looking to achieve, what price are you prepared to pay? What is the value to government? So then having agreed a rate charge, a rate card with the Commissioner, what we then do is provide the finance to allow to commission to find the third sector organisations, so in the case of, say, homelessness, local third sector housing providers, drug rehabilitation, people that work with people suffering from alcohol, local mental illness charities, and try and find a consortium, bring together all the interested parties who have got the best solutions to solving the issue at hand. We then get paid just on an outcomes basis, and generally get paid, we're able to put in all the finance up front, we get paid on an outcomes basis when we've achieved the result for the beneficiary. when the outcome for the beneficiary has been achieved is only when we get paid. So just give you a couple of examples. I'm going to spend most of my time on health, but just give you a couple of others. So under housing and employment, one of the first things that Andy Burnham did, becoming mayor in Manchester, was to commission, with our support, a social impact bond across Manchester with the aim of eradicating homelessness and rough sleeping in Manchester over the next few years. So we've agreed a rate card with Manchester, with Andy, that says, well, for the roughly 300 people that are persistently rough sleeping, we get paid once we get that person in secure accommodation for 6 months and then 12 months. We get an outcomes payment if we get to the underlying issue, which is usually, but very often, drink or drugs or underlying mental illness issues. And we get paid after 12 months if that person has sustained education, training, and hopefully employment. With that payment card, we've then assembled a consortium of local housing providers, mental illness charities, and so on. We then fund those charities with long-term funding, which allows them to invest in making sure they've got all the right resources in terms of people and systems up front to deliver the outcome. I could talk all day about these, but in the interest of time, I'll move on and just focus a little bit on health. So health, we think, is, since the main issue is around prevention, health ought to be the largest opportunity, we believe, for outcomes, contracts, or SIBs, playing a role in prevention, given the pressures on the system. It's been one of the hardest parts of our business. So you see we've done a lot in children's services, a lot in homelessness. Building trust with the health service has proven more challenging. However, we've started to get some fantastic early results. So our first one, which was commissioned a year or so ago, is in Newcastle. The early success of that has led to that to be expanded into northeast Lincolnshire, into Grimsby. And most recently, we've been commissioned in Devon by the Devon Local Authority, a diabetes prevention SIB. So just talk about waste to wellness. So what does this do? So this works, it's social prescribing. So we've agreed with the CCG, a rate card, to work with those people who are suffering from long-term chronic illnesses in the northeast. Those people are suffering with diabetes, heart disease, these long-term chronic conditions account roughly for about 70% of the NHS spend. So we get paid in this outcome. The outcomes payment is on savings in secondary healthcare. So working with people with long-term conditions and aiming, by interviewing their lives, to reduce the secondary healthcare spend. The early signs are fantastic. We're working at the moment with about 4,500 long-term condition sufferers. We aim over the course of the program, over 7 years, to work with 11,000 people. This is just in Newcastle. And we really think, based on the early outcomes, that this can be significantly scaled across the country. And this guy in the photograph here, although we're working with like 4,500 people, individual case stories always seem to resonate very well. So the guy in the photo here, this client, was suffering from severe depression and was reluctant to leave his home. He's also a type 2 diabetes sufferer, and his diabetes was getting progressively worse due to poor eating habits and zero activity levels, really being confined to his home. So he's feeling increasingly isolated. His family were not living in the area. through one of our programs, he attended a Why Wait program. He was engaged on a 3-month free gym plan at our cost, attending at least twice a week. Also, wrapped around that was a lot of education, encouragement around diet and eating habits. Pleased to say that the guy in the photograph, I can't use his name, I'm afraid, but this guy is now his diabetes is in remission, and he's now recently secured a job actually in a restaurant, and very much his life is coming back together. Of the success there, this one's interesting because it's not been, the Diabetes Devon, this has not been commissioned by the NHS. This has been commissioned by Devon County Council. So this is working with a cohort of people that are at risk of being type 2 diabetes, type 2 diabetic. I think many people in the room are aware that diabetes treatment accounts for about 10% of all NHS spending. And the idea here is to work with quite a large cohort in Devon over a 2-year period, and to try and make significant changes to these people's lifestyle, which is, of course, exercise, diet, and mental well-being. It's also interesting, this one, because we're not being paid because they're not diabetic. We're getting paid on them, of course, not becoming diabetic, but also getting payments based on improvements in blood sugar, waist size, and weight. This is the first one with local authority, so we're going to monitor its progress very, very carefully. So in conclusion, I guess I just want to say that there is a lot of investment out there that wants to invest into businesses that can provide solutions and into third sector organizations. So foundations, endowment, local authority pension funds, government pension funds, all want to invest into this stuff. Our job is to match that wall of cash that's out there to solutions, innovative financing solutions that can seek to address the issues that many of you are concerned with in the room. Thank you very much.